Welcome to another episode of Before and Beyond. Today we're going to talk about veneer removal. Okay, this is going to be a bit more of an intense episode because I'm going to walk you through step by step of how we actually do our veneer removal here at Dental Designs Clinic using laser. So this is a patient of ours, and she previously had porcelain veneers done illegally by a beautician. And so within about a time span about 2 months, she really hated the veneers because they were too bulky. It didn't blend in with her face, and the gums were all looking very, very swollen. It bleeds a lot when if she brushes her teeth. Food always gets stuck inside, and she really wanted to get rid of them as fast as possible. Now, the challenging part is that we want to make sure that she was actually quite happy with her existing teeth, just that the color was not good. So the plan was to actually try to remove the existing veneers as gently as possible, without damaging the or limiting the damage of her natural tooth anatomy and structure, but at the same time preserving the quality of the tooth, right? We also need to make sure that we also whiten the teeth up as well eventually. So the plan is to remove her veneers using the laser, and then from there we whiten the teeth up with some whitening gels. All right. So first and foremost, I'm going to talk about how we actually do it. So I'm just going to go into our tooth anatomy here. This is a picture that I got off from ChatGPT. But essentially, if you have a look, this is the anatomy of the tooth, and I'm just gonna just draw. Okay, I'm just gonna just draw a veneer. All right, so here goes the veneer. So it's gonna go here, and it's gonna go like that. All right, so this is the anatomy of the tooth. This is the anatomy of the veneer. So this entire part is where the veneer is gonna go. All right. And between your tooth and the porcelain veneer, we're talking about porcelain veneer now, not composite veneer, porcelain veneer, okay? So between the porcelain veneer and the tooth lies the cement space, all right? So this is where the glue is sandwiched between the porcelain and your tooth. Okay, all right. Now, in the case of a laser removal, what happens is that the laser goes through. The laser goes through the porcelain veneer, because the porcelain veneer is a bit translucent and it doesn't absorb the energy of the laser. It goes through it. It goes through it here. It goes through it. And what happens is that it actually burns off a layer of the glue. Burns off the layer of glue. Burns off the layer. So that's how the laser works. Now, in the case of our patient, we actually are not doing. It's a bit of a different scenario because the person didn't trim the tooth. They literally just pasted on the veneers. So if you look at it previously just now, if I just remove the veneers and this whole entire chunk of veneers came off, what the patient would require is a new set of veneers because the tooth is already damaged or already been trimmed in already. So something needs to go on top of the existing tooth again. Otherwise, the tooth will be sensitive. It's very unsightly and all these things. So if the tooth has been trimmed and we are removing the veneers, there's a very high chance that we need to do a new set of veneers to cover those teeth up again. But in the case of this patient, she had the veneers that were done. They were done on top of her existing teeth, so it goes like that. And obviously, wasn't that well done, right? So what happens is that you can see that there's a jut over here, so bacteria can go inside here and cause problems, and she didn't like it, obviously. All right, so let's say like that. So the cement gap, it's found between your tooth here and the veneer, right? And so technically when I remove the veneer, I will be just removing this layer here. All right, the veneer. All right, and using a laser, because the laser will burn off the glue. And then from there, all that's left is the glue behind, right? And the glue behind is usually discolored, or they are burned because the laser will burn off the glue, so they look black. So the polishing part would then be to remove this layer of glue between the veneer and your tooth. So that way we try to keep it intact. But during this process, we are going to use a bit of the drill. And so sometimes the drill will actually damage and scratch the surface of the tooth. So what happens is that sometimes you might get like little indentations over here. That's very, very minor and very microscopic, but it still can be seen if you use a very high resolution camera to have a look. Okay, so without further ado, I'm going to just show you a process of what we do. So essentially, what we're trying to do now is we get out the laser. So of note, right, is that the tooth on this tooth over here where the laser is pointing to is actually a crown. So when we take out the crown later on, it's going to look like we have severely trimmed tooth, and that's because it was actually a crown to begin with, and a beautician actually glued on the veneer. Pretty creative. They glued on the veneer on top of the existing crown, but we know that the bond strength is not that good. It will come off eventually, but that's why you might see that appearance. So right now, what we're doing now is we're actually using the laser, and so it's a touchless system. The laser just shoots beams, and you can see there's darkened areas forming on top onto the veneers as well. You can see, and that's essentially burn off glue. So you can see that whenever the laser goes there, it will create a mark, and it's going through the porcelain veneer, and it actually burns off that glue over there. So that's happening now. It takes a while, so let's speed things up a bit so you can see that we are trying to do that, and it's going and going. It takes a while because what we're trying to do is we're trying to use the laser to burn off any spots of attachments that the veneer has between the veneer and the tooth structure. Okay, so that's happening. Okay, all right, and once that's done already, it looks like that. So now, once we find that it's really, really much detached, we use an instrument. This doesn't hurt, and in fact, this patient wasn't on any form of local anesthetic. We actually use something like a little lever to pull out the veneer. Okay, so you can see this is what we do. We go to an edge, and you can see the veneer just flies off. Okay. All right. So now you can see it's all removed already, and this remaining matte surface of tooth structure is actually the glue left behind. And what we do now is we then go on to other teeth, and we will subsequently polish those teeth up so that we can remove the glue and get a nice clean surface. Okay, so this is the one that I was talking about. This is the crown itself. So I'm just gonna you can see if I put my lever on top of there and I pull it off, it comes off and it's severely trimmed. That's because it has been an existing crown previously already. Now we move on to the other teeth, and this is going to go in macro. So it's going to go here. You can see what we're doing. The laser is going through the veneer, porcelain veneer, and it's burning off the glue, and you can see the glue is turning black, right? Because it's being burned. All right. So we want to make sure that the power of the veneer, the power of the laser is not too strong that it actually damages your tooth structure. It's just strong enough to be able to detach the veneers from the porcelain veneer. Sorry, detach the glue from the porcelain veneer. So we just need to make sure that we use the laser and go through every areas, making sure that we remove the attachments, okay, very carefully. All right, so you can see it's discoloring because we're burning off the glue, and then eventually it takes a while. So each tooth can take, depending on how well it's glued on, it can take between 5 to 15 minutes. Okay, and in this kind of scenario where we are doing upper and lower teeth, it can take about 1 to 2 hours. All right, so and we want to go slow. You can see we just remove the veneer, and then you can see it's really dark and discolored now. And so we just ignore that now because we're going to come back in to polish up all those teeth. You can see that now we're just using the other, we're going on to the other veneer. And sometimes you can see that what has happened is that we just now use the veneer, the laser, and straight away the veneer just chip off, okay, just breaks off. I mean, so and that's typically because the veneers were done too thin, or the material they use is substandard material, and that's why it breaks off. Okay, and so going slowly, removing all those areas, making sure that we can get all these attachments away. So I'm just gonna fast forward that because it's mainly the same thing. Okay, so you try to use my fingers to see whether it comes off, and then we use this lever system again to actually hold on to the grip and try to remove it. Now you can see this is actually quite stubborn, right? So if it doesn't come off, okay, it comes off. So you can see it came off. All right, but if it doesn't come off, then we just go back in with a laser again to try to get as much detachment as possible so that we can do it safely. Okay, it's a no-go for us to use a drill to grind off the veneer, because when you grind off the veneer, what happens is that if the material, if you're using a drill to grind off the veneer, there's a very high chance that you're gonna damage the tooth surface, and we want to try to avoid this as much as possible. Okay, same thing, we're just going on different sides, and we're going to use the laser to just burn off the glue and remove it. Okay, so this is how it looks like. So we're just using the laser, it's going on. And you can see this is a bit longer because the attachment is really quite strong. And we're just going row by row now to burn off the area. You can see that this needs to be under high water as well, because the water will help to improve the laser efficiency. At the same time as well, it cools down the tooth so that the tooth doesn't feel so sensitive as well. Okay. All right. So, I mean, unfortunately, I can't show you the before and afters over here, but I wanted to show you the process because a lot of our patients nowadays have had veneers done before, either by another dentist or by a beautician or somewhere else, that they're really fearful of removing it. But it's really not a bad process. It just takes a while to remove, and we need to remove it carefully, and we want to remove it under high magnification so that we know that we won't be damaging any sort of tooth structures as well. All right. Great. Very nice. So we're just removing it, and then we'll follow up with some polishing as well. Okay. So almost done. Going back over here, and we're just removing the last bit, and then coming back later on to polish those areas as well. Ta-da! Yeah. So it's all gone. So it's not that hard. If we didn't have a laser, then it will be much more difficult. Much more difficult because there's no way of detaching the dentist has no way of detaching the veneer to the tooth from the tooth, because it's really quite strong. They would have to grind the veneer off, and it's a laborious process and creates a lot of heat and damages the tooth a bit. And so I wouldn't want to recommend that if you have a laser. Now, I get this question a lot, and the question I always get is, hey, what happens if my veneer is not made of porcelain but made of composite? Now, there are really essentially two different types of materials of veneers nowadays: composite and porcelain. Porcelain is a higher grade material, and that's what we usually use for more permanent veneers. And that's because they have nicer aesthetic outcome. They are more long lasting. They do not dull off over time, and they are also stronger as well. So there's a lot of reasons for using porcelain over composite. Composite is more of an interim material, and the beauty about composite is that it's a lot more additive, so we don't need to trim. There's a possibility that we do not trim as much too compared to porcelain veneer. So porcelain veneer is a viable option, especially if you're younger and you are not really sure whether you need to do you want veneers in the first place. All right. So let's just go with what's the difference if I am talking about removing those composite, right? So just now, remember I mentioned, maybe I can just explain again. So just now, remember I mentioned that with porcelain veneers, the light actually goes through the veneer because the laser doesn't get absorbed by the porcelain. It just goes straight to the cement, the glue, and the glue actually absorbs the laser energy and it burns away. Okay. Coincidentally, the composite, the glue, is made from composite. Okay, so composite veneers act as the same way as the glue. So imagine now you don't have that composite anymore, but you have just the whole entire part is just made of glue. Right? Because essentially they are the same material. It's just one is in a liquid form, one is in a paste form, or any other materials that is composite polymer based, right? So what happens is that the laser cannot go through the porcelain because there's no porcelain anymore. So laser energy gets absorbed, okay? But as soon as it touches the composite, so where it touches composite is over here. All right, so it just touches composite over here rather than going all the way back here. So what that means is that if I use a composite, if there's a composite veneer and I use a laser, I don't detach it, I burn off the exterior surface. So what you're gonna have is like these blocks and blocks of holes that I create using the laser, right? And so in this kind of situations, if I'm using a laser for a composite veneer, it is not effective. What I have to do is, unfortunately, I gotta treat it like an entire thick piece of glue that I would have to use a drill to actually go and polish away all these parts. Okay, so I need to use a drill or like a fine drill, all right, to polish away very carefully using high magnification to remove those bits of composite, all right, which is essentially glue. All right, so there is a difference, and so unfortunately, porcelain veneers is a lot more easier to remove compared to composite veneers, but it can be done. And if you feel that you are one of those people with any veneers that you want to remove, please let us know and we can definitely help you, especially if your veneers are not causing you to have not confident behavior, or you feel that the gums are bleeding all the time, or you feel that food always gets stuck inside all the time, or you feel there's a bad breath because of this composite veneers, and you're ashamed of your composite veneers or porcelain veneers. Let us know. We can always remove it and we can always plan ahead. Okay? Alright, so thank you so much for this episode of Before and Beyond. I look forward to seeing you guys next time in the future. See you then.